my name is Jay Wilson. I am the founding president and CEO of Melinated Moms. We are a community center women empowerment organization, and we're doing the work to create more opportunities for maternal health equity to be in the forefront and not an afterthought. This is an incredible week. If you've never heard of Black Maternal Health Week, congratulations, I'm going to introduce it to you. But everybody in this room is incredibly important, and we all have a role in being able to change the narrative of what Black maternal health, mortality, morbidity, and vitality actually look like. So this conversation is near and dear to my heart. I am a mom, maybe not obviously, but I am. My girls are here. Ava, she's in the back, she's 13. Nadia is over here to my left, she's 16. And they are my why. They are the reason that I do what I do. They are the reason that we all have a responsibility, not just to ourselves, but to our next generation, to have these conversations, to normalize the understanding of the critical need that maternal mortality is really affecting the Black and brown community at such a disproportionate rate, and it has to stop. I wanted us to have this conversation in the gathering spot for so many amazing reasons. But mainly because I wanted us to see each other and really create more understanding of that the call to action. You know, how do we, as individuals, as a community, who we are professionally, who we are personally, how do we take that step? How do we create more opportunities to serve and to support and to grow in these spaces, whether we have a uterus or not? So this is not just a conversation for moms, this is not just a conversation for dads, this is a conversation for people who come from other people, and I think all of us do. Yeah. I'm incredibly excited to introduce to you all these amazing panelists. These women are so powerful and dynamic in their own right, and I'm not going to do them any justice by introducing them. I want to make them introduce themselves, because that's the best way to do it. So before I go down my rabbit hole, I want everybody to just have a couple little housekeeping rules. On your seats are our programs. It not only contains our run of show for today, but it gives you more insight on who our community partners are, our sponsors, the people who have been a part of Melinated Moms since our inception 7 years ago, as well as you. So you'll see pictures of our community members and all the people who have really been a part of why Melinated Moms is not just an organization for and with moms of color, but it's a global movement that is really changing what maternal health equity looks like all over the world. And I'm incredibly grateful that I get to lead this thing, and it just came from an idea of wanting to have support as a mom myself. My personal journey with maternal health, mortality, and morbidity. I am a 4-time survivor of preeclampsia. I am a stillbirth mom, and when I gave birth to my oldest daughter, Nadia, I actually went blind in my left eye, and I had no idea that any of these things that I experienced in my pregnancy was related to mortality or morbidity. I just thought that's just what it was. And as I got the opportunity to get into this work and really learn more about why maternal health matters on so many levels, I realized this community that I started was not just about having a social place for me to meet other moms and not feel lonely and isolated. It was an opportunity for me to educate moms, for me to advocate with moms, and put them in these same seats that I'm able to walk and sit in, actually. So, all right, I'm gonna get on the stage. I'm not gonna jump on it, because usually I'll look like I'm a single shot. So I'm gonna call everyone up to the stage, okay? So I'm going to call our panelists up one by one. First, I'm going to call up Lynette Trawick. Are you here, my dear? Where are you with your fabulous self? Come to the front. Next, I'm going to call the icon. Oh, you're not sure. Next, I'm going to call Jennifer Evans Rice. And last but definitely not least, Jasmine Winters. So first, I want to hear from you, Lynette. Tell us who you are and why you're so fabulous.
So I'm fabulous because of God, because He is, so I am. So I'm Lynette Trowick, and I am originally from Philadelphia, or Philly. It's kind of like the difference between like Baltimore and Baltimore. Right? So I'm from Philly. And I am a wife, and I'm also the mother of 11 children. I also am the founder, CEO, and of IMU. So IMU is a nonprofit organization, which I'm sure we'll talk a little bit more about later.
Jennifer.
Hello everybody, my name is Jennifer. I am a wife as well. I have 3 beautiful little girls at home, 2 toddlers and a newborn. I am a blind mom. I've been blind since I had my first daughter and then onward. So I'm very excited to be here to talk more about my journey.
And Jasmine.
Hello everyone. I am Jasmine. I am a mother of 4 children, 3 girls, 1 boy. I am an IVF journey mom. Also the founder of Protective, that's my other business, I'm sorry. Peaceful Minds Haven, mental, we're in a different hat, sorry, which is a mental and maternal wellness nonprofit. Wonderful, y'all are so modest.
I think it's really important to really understand the journey of these 3 women, how it relates to what we're talking about, right? And also what moms in the margins really was like, right? So when we started our program, we started with the trailer for the documentary, which is called Aftershock. Aftershock was created a few years ago to bring more awareness to the loss that happens when there's medical neglect, ignoring and dismissing for Black women who unfortunately have lived back children, but their families are, they're in a state of aftershock. How do they move on? How do they pick up the pieces? And these fathers who are in the movie, they are falling in these different margins, right? So their wives, the women that were lost, they were also living in the margins. And what does that mean, right? So they had a lot of intersectionality with wanting more information, with understanding the diagnoses they had. They sought the right support and was still met with resistance or completely ignored. And unfortunately for those women, they lost their lives. What we're going to talk about is, thankfully we are here, but how do we pay attention to what is happening in our community when we speak up and we still are not heard, or when we're seeking support and it doesn't provide the support that we need, right? So the 3 of us, or 4 of us, we all have a great story to tell. I'm going to kind of dive right into it. So the first thing I want to open with is one of the quotes actually from the movie to help us slide into our conversation. So there was a congresswoman in the movie that says, "Our healthcare system, including reproductive healthcare, was built on a legacy of systemic racism, and that legacy continues today." So the woman that gave this quote was a white woman. Why is that significant? Why is that significant when we're talking about moms and emerging? Anyone?
I feel like it's not changing, right? It's been that way for how many years, how many moons, and at this point, we should have been past that. We should be at a point where moms can go ahead and go to the hospital, give birth, and not have to worry about that systemic racism. We should be way past that at this point, and I feel like it's still happening, which is really unfortunate. So I think the more we talk about it, the more we have discussions like this and programs like this, the more hopefully things will start to change. And maybe in 2026, we won't have to have these discussions anymore. Is the hope.
Yeah, I agree. And also, I think, just thinking about the dynamic of our culture, as Black women, I think that a lot of things aren't being addressed, and maybe it's not because of intentional ignorance, but just it's not a thought. So I think just thinking about being intentional about having these conversations and the things that we need, as Black women, because it's not the same. We don't all just fit in one bucket because we've all faced different traumas, whether we realize it or not, especially as a culture. So those conversations definitely need to be built.
Yeah, I agree with both of my fellow panelists here. We're dealing with a system that was not built for us. And it's going to take an overhaul, it's going to take a mind renewal, and just a complete overhaul. Why do I keep going on? A complete overhaul to unlearn, speaking of our white counterparts, to unlearn what has been embedded in them. We have a high tolerance of pain. We can just take more than our counterparts, and that is so not true. It's so not true, and it's going to take for our healthcare systems to admit that, hey, we've been wrong, and it's okay to admit that wrong and do right by a race that is on fire. That's all I got.
I can add in one other thing. So it's easy to think that this is happening in like the lower socioeconomic areas because there's so many people and there's not enough doctors and such. But this is also happening in like the rich areas as well. So I don't think it matters how much money you have or don't have, where you live. It's kind of happening across the board, which is really unfortunate.
I'm so glad you brought that up because I think what often happens is they'll classify it and justify it. Well, they're poor, they're uneducated, and that's why it happens, right? But this is the difference between quality and equity, right? So the quality, we all can get to a hospital. We all can get the same type of care, but that's not it. We all are not having the same experiences. We all are not being met with the same types of support that are connected to our needs, right? So we're going to talk about each other, our own journeys and everything. So we'll dive a little bit into that. But I think it's important for us to recognize that these issues that we see are not exclusive to poverty, and it's not exclusive to educational backgrounds, right? I know for me, when I was having my kids, my ex-husband is an engineer and I am a nurse. I have the medical knowledge and he has the money. And I still That's right. But I still was met with so much resistance. But I'm asking simple questions. How do I get the support that I need? Even asking about a doula. So I was a high-risk pregnancy, and I asked, hey, how does a doula fit into this? My doctor told me plainly, well, doulas can't work with you because you're high risk. And here I am, 16, 13, 156 months postpartum, and I found out that I actually could have had a doula. And I may have had a completely different experience had I been informed with the right information. So actually, can we dive right into that? Can you talk to us about your journey and also how you became a birth doula?
Yeah, so one thing that I didn't mention during the introduction, so I am also a mom living with HIV. So I have been living with HIV going on 17 years. I actually celebrate that date. Because like I said, I want to emphasize the word living. I am living with HIV. Right? I'm not operating with HIV, I'm living. And it just happens to be one part of who I am. I'm also living with depression. I'm also living with PTSD. all of these different parts of who I am. It just makes me who I am. So I'm living with HIV, like I said, going on 17 years now. So I had, like I mentioned, I have 11 children. My husband and I have 11 children. And with my previous children breastfed, I had that experience, I had a midwife, and this was prior to me learning about what a doula actually was. So I had a midwife. I went to I was actually invited to a speaking engagement to talk about being a mom. And several women got up and said, yeah, because I'm doula, and that's all they kept talking about. So I went and I learned about it. I said, wow, that's amazing. I want to do that. So our youngest son is 9 years old, and he's my only child that I've had since living with HIV. And so my experience was completely different. I went and I tried to, at the time, get a midwife, and they told me that I could not. Similar situation because I was high risk because I was living with HIV. So for those of you who don't know a lot about HIV is a chronic illness just like any other. As long as it's managed, you're fine. Just like diabetes, as long as it's managed with your numbers and your medication, you are absolutely fine. So I'm what's called undetectable, and I have been for some years. And with me being undetectable, that is not a high risk, it's definitely not a high risk situation. But that's what I was told. So fast forward to when I was giving birth, I was told that once I go into labor, immediately get to the hospital so they can put in an IV and do the injection and give me medication and so on and so forth. So I went along with what they said because these are doctors, so they know best. However, I always like to emphasize that childbirth is not a medical procedure. Right? It's not supposed to be a medical procedure. It's a natural occurrence that we go through. And that's just it. It's something that we go through when we choose to go through. But it shouldn't be a medical procedure. So anyway, long story short, because of the experiences that I had during my pregnancy and during childbirth, I decided later on, once learning what a doula was, that I wanted to become a doula. So I'm now in the certification process of becoming a doula. I have supported 2 out of 3 women so far toward my certification to actually become a certified doula. So I'm on my way there, and my specialty, I want to focus on women living with HIV and being a doula for them and being that support in the room to help them show them where their voice is, and advocate their needs and advocate their wants because they're important as well.
I think you're going to be an amazing doula. I may not be able to see your face, but your voice is very calm. I'm helping out.
I love it. And I think that's really going to help us set up the next question. So what you're doing is showing us the power of community, right? We had a previous conversation where we talked about what we need to feel seen and feel supported and feel like we have a safe space, right? And the main thing is representation, right? So we can get representation through the diagnosis, representation through our race and ethnicity, and all of these other ways of how we intersect with people, right? But when looking for someone living with HIV and saying like, all right, I want to find that community, and it's still a lot of stigma around it, it can feel a little daunting, right? But I love what you're doing because you're calling into the carpet, right? And you're also giving more space to women who are living with HIV, who want to have a family, and giving them the yeses instead of the nos, right? We're constantly being told what we can't do, but you're telling them, here's what you can, here's how we can, and they're not doing it. So my next question for us is, really I want us to think about that community piece. So maternal health outcomes don't start and end with the mother or the birthing person. It also strongly is supported and sustained by the community that supports her. So how can we get fathers and partners to be more active in maternal health equity? Jennifer?
I would say those fathers come to all those appointments. There are so many appointments we are about to give birth in that prenatal portion. Be included, be involved, ask questions. be there, whatnot. The main thing is just to ask questions. So ask questions to the person caring for the mom. Make sure that she's okay. What can they do to help? Because you don't know what you don't know, right? If you're a first-time dad, a first-time mom, you don't know, just ask those questions, dads. Ask questions to the healthcare providers. One thing I learned in my nursing experience as a nurse, working in different hospitals from New Jersey all the way down to Georgia, is the patient, and in this case the mom, gets better care when there's someone else at the bedside. And so if the dad is there at the bedside and he's watching, he's observing, he's not sitting on the couch somewhere on his phone. He is right there next to the mom, looking at what you do and whatnot. That mom is going to get much better care than if either there's no one else in the room or if that person is just not paying attention. So I just say get involved, ask questions, be present. Not physically, but be actually there, present, asking questions and just show your face. That's really gonna help out.
I agree, Jennifer, and just piggybacking, helping fathers to know the language, to understand a woman's reproductive system, and teaching them how to advocate is going to be really important. Having these settings and these conversations, it's really important to encourage the men in our lives, that even if it's not your partner, it could be your son, it could be your brother, it could be your uncle, it could be your father. We need our men, and we'll get into my story later, but I didn't think that I was going to have a partner after our morbidity story, because I wasn't recognizing he was also depressed. He didn't understand the signs of postpartum depression, and if we're not educating, starting in our home, our men, and then reaching out to the community and providing programs just like these, but tailored to the men in our community, it's going to be hard to help them understand exactly what those signs are and how to speak up for us and know what that medical terminology is. It can't just be, hey, maybe positive pregnancy test for having a baby, and then you're here for the exciting parts, but you're not Googling on your phone as much as you're Googling what that sports play is. Like, from the moment we find out, because of the history of how we have been treated medically in the Black and brown community, it starts from that moment. We have to start educating ourselves, getting in touch with doulas who are going to, I know the doula I had, she was amazing, and she actually took the time, I think we had 4 sessions that she required my partner to be a part of to help teach him. If this happens, this is what you need to say. If this happens, this is what you need to do. And if that happens and I can't make it to the appointment, you get me on the phone ASAP. And just that education piece, including the work. Because when they feel outcasted, they step back even more. And then we don't recognize that they're depressed as well.
That's a really good point. So my husband has said that during our pregnancies, and he felt that it was all about me, which yes, it is. I'm the one that's pregnant. So it's all about me, and there's nothing for him. There's no appointments for him, no one's checking in on him. Even friends and little clients, hey, how's Jennifer? Not how's Lamar, how's he doing? Are you okay? Are you scared? Are you nervous? Are you excited? They're all asking about me. And so, yes, he is involved as well. We made these babies together. You don't just stop because birth the baby stops after their session. We keep going, right? And so I think that's a great point of just getting the dads involved and letting them know this is what you do, this is what you don't do, this is what to look out for. So that is a great point.
Yeah, and I'm really seeing more fathers stepping up to the plate, right? There's a young man in Milwaukee, I believe, who's the daddy doula. And he's actually trained, and he's actually going around the country training more dads, like literally looking for fathers to get them more involved so that they can understand this. And the beautiful part of that is this is a man who's showing other men, this is how you step up into that space, going from man to father, right? The unfortunate part of this is a lot of these men who are doing this work, they're doing it from the side of mortality. So they're doing it without their wives and their partners to parent their child, right?
I'm grieving.
Right.
Yeah.
Exactly. And no one gives them that space, right? So again, we're gonna talk. Talk. Right. But we understand our feelings and perplexities that go along with our hormones and with the doctor's appointments, and now we have this new human that does things and all of the stuff, right? But our partners also are experiencing something completely different, right? It's a different experience because it's not connected to their bodies, right? But they still want to know, how do I become a part of this? How do I stay a part of this, right? So Jasmine, I would love for you to talk more about your story and help us understand morbidity, not just mortality. With the microphone.
Yeah. So I'm still healing, so y'all might have to bear with me if I get that little ball in my throat. So I have an IVF journey. Started that journey in 2022, gave birth to my son in July of 2023, so it'll be 2 this July. I was diagnosed with placenta previa, and for those who aren't familiar with placenta previa, it is when your placenta is covering where the baby needs to come out. And with that, it is a life or death situation if the placenta punctures, because you will bleed out within about 30 minutes. So if you are not near a hospital or medical attention, it can go sour very quickly. I was cleared for the placenta previa because sometimes it will shift on its own as your uterus grows. I should not have been cleared, and it caused some complications during labor and delivery. When I got to the hospital, I was not treated with kindness, gentle, just respect. And everything for me just seemed rushed. From the time it was time to start pushing, and the doctor was upset with me because she felt I wasn't pushing correctly. Mid-push, she took her gloves off and left the hospital room and basically told me, until you're ready to start pushing the right way, I'm gonna go to another patient. And I panicked, and I looked at my doula and I said, you know, Jess, don't worry about it, I got you, I'm here. We'll fast forward some other mistreatment that took place and get to the labor part of things. So after we got my son, Cairo, out safely, I wanted to go to sleep. And in my mind, I knew that was not a normal reaction to after giving birth. I didn't want to hold my son. I kept telling the doctor and my nurse, I don't want to hold him, I don't want to do skin to skin, I just want to go to sleep. My nurse was angry with me for that and said, well, you have to do skin to skin for at least an hour. And I said, I can't. So I started shaking really bad. And my partner says, why is she shaking like that? At this point, my doula's gone, my sister who was in the audience, she was in the labor and delivery room, she had gone, my mother-in-law was gone, and it was just my partner and I. And the nurse said, well, you have to do skin to skin. I said, I can't. So I start shaking. My partner says, well, why is she shaking like this? Oh, that's normal. It's after birth shakes. But I'd given birth 3 times prior, and I knew that that was not normal shaking. All in all, my body was shutting. I was dying. I was internally bleeding for over an hour after telling them something's wrong. I'm going to sleep, something's not right. I don't want to do skin to skin. Mm-hmm. Sorry. I just remember feeling scared. And at this point, my mother-in-law was allowed back into the room, and I just said, I'm scared. Don't let me go to sleep. I'm scared. I needed over 2.5 liters of a blood transfusion. I needed an emergency surgery. And they told me, are you ready to leave after 2 days? Never got checked back in. They had to put a balloon inside of me to stop the internal bleeding. So they went in through my vaginal area and blew up a balloon inside, and it was kind of like the balloon was acting like a Band-Aid to stop the uterus from bleeding, which needed to stay in for at least 2 days. And because they knew they were taking it out after the second day, they said, well, when we take the balloon out, it's time to go home. And nothing just seemed right about any of that treatment. And so when the aftershock was playing, I still can't bring myself to watch it. Even just the preview had me a little, still in my healing phase, just to know that I would have left behind 3 children and a partner and loved ones and, 4, I'm sorry, he was my 4th one. It's just, my postpartum wasn't good. Actually still healing relationship-wise from it, which is what brought me to birthing my nonprofit, because a lot of Black and brown families, they don't make it through that postpartum phase because he doesn't understand her, she doesn't understand herself, she's not understanding why he's not stepping up and doing more, but he's sad too. He experienced that trauma with you, sis. So, it's just lack of communication, lack of empathy, lack of understanding that happens within our Black and brown communities. And so I really appreciate moments like this where I can share my story, because there's healing in story sharing. And every time I tell my story, it gets stronger. And then there's some times where I don't get that little ball in my throat. But then there's other times where I'm just like, this is a lot. It comes in waves. It's almost like a death. It's almost like you experienced a death. And there's sometimes you can talk about your loved one and you're totally fine. You can laugh about it. And then there's other times where it's like, wow, why did that just hurt? So that's my story. Thanks for listening. Yeah, I think it's important, number one, feel your feelings. I know I'm trying to make everybody laugh, but I'm serious. I really want you to know that this is a safe space. We're at the gathering spot. This is literally what they do, right? But this is our safe space. And we need to know that these things are happening so that we don't feel like we are isolated, right? These are the reasons why Melinated Moms is so important to create. And the thing I love about your story is the way that you and your partner have been able to reconnect through your nonprofit. We went out to your event a few months ago, and hearing the stories from both ends, how he's like, I didn't know what I could do. I didn't know how I could show up for her. And you both being able to meet in the middle and saying, here's how I want to reconnect with my partner so that we can both be great parents for the child that we both wanted, right? This is what we need to hear. This is how we need to feel. We both want to make sure that we are seen, right? Because we've created these people. And we want our children to know, like, their lives were not created in vain. We want to be those parents for them. So when they decide they want to become parents, they know what to do, right? It's not going to be a reactionary experience. They'll know how to ask the questions. They'll have the informed consent to move forward in whatever direction they want to, because they saw their parents do it, right? We're our kids' first teachers. Woo, take a breath.
I think our kids are going to be absolutely amazing empathetic individuals because we're showing them how to do it.
Yeah. And I don't know about y'all, but I know for me, I was born in 1980 something, and and when I was growing up, those were not feelings or things that were encouraged, right? People were not asking you, well, how do you feel after that? Do you need time, or did you take a break? They're like, you pushed through, you prayed away, you act like it didn't happen, right? I remember when I became pregnant for the first time, I was 19 years old, I was a sophomore in college, and I was scared. I had no idea what was going to happen. I didn't know what I should ask, but of course, you go to the people who raised you. So I went to my grandmother, shout out to Nana, I miss her so much. But my grandmother raised me, and I asked her, Nana, what was it like when you had your kids? And verbatim, she's like, you just do what the doctor says. And I know that she wasn't saying it from a malicious way or a malicious place, but that is what she was taught. You don't ask questions. Whatever happens is what happens, And it hurts to know that our community is the only one that is receiving that narrative. And I think that's why, again, it's very important for us to have these conversations so we can change that. And so we can actually share these stories and collectively find our own call to action. So we're not stuck with these feelings of what ifs, where do we go? How do I manage this? How do I, and we don't have to spiral, So.
And I'm proud of us for women for like speaking up and
Yes.
being on the panels, like to really say something. And then everyone that's watching, everyone that's here, to kind of like continue to speak up and say something. Because back in the 1980 somethings, they did not talk about it, right? You listen to the doctor, you pray about it, you hush. You put on this facade of I'm okay, nothing's wrong, life is great. But sometimes life is not great. One of my friends from some time ago told me about this. The duck phenomenon, right? So on the surface, you see this duck, they're quacking along, they're on the top of the water, they're floating. They look like life is great. But underneath, their feet are paddling. They are going 100 miles an hour. And I feel a lot of individuals in the Black community are like that. We put on this face that we are okay, we are fine, nothing's wrong. But underneath the surface, underneath that water, we are struggling to push forward. So I'm proud of us four ladies and anybody else in the audience for speaking our truth.
Beautiful segue. Come on, Jennifer. So I want to talk a little bit more about your story, Jennifer. So, I shared when I was pregnant with my oldest daughter, I lost my sight temporarily in my left eye. And I just couldn't imagine, like, oh my God, what happened, right? And when we had our conversation and learned more about your birthing journey, you told me your sight progressively became limited. And as you have more children, your sight has kept going low. That's what you kept using. So can you talk to us about what that looks like and how you navigated that space?
Yeah. So when I had my first daughter, she was born in 2021. I was born with 20/20 vision, and as the years go on, my vision just go down. So I had something called panelistitis, big term for just my eyes are bad, right? I'm blind. And so I had my daughter in 2021, and after I had her, all your hormones are out of whack, your immune system is out of whack, and so my vision went down. And I went to my doctor saying, hey, listen, I really can't see that well. I know this is gonna happen, this is progressive, and y'all told me since I was in elementary school, but this is a rapid decrease, what's going on? And they said it's your hormones, it's your immune system, things are just out of whack. It might bounce back, as well as this might be your new norm. And I said, okay, all right, let's figure this out. I tried walking with a cane, even though I wasn't ready. I wasn't mentally ready to accept that I was going blind. And so my husband and I wanted another kid. And so we got pregnant again, we had another kid, we had another rapid decline in our vision. Or, well, in my vision, but we're a unit, so our vision, right? And so I said, okay, well, with every pregnancy, is this going to continue to happen? And they said, in a sense, yes, because your hormones are out of whack and your immune system is low, and that's just part of your postpartum experience. Your vision is going to go down. There's medication, there's treatments, but there's not much to do because that's your body's response. I even asked the doctors to save my vision. Are there hormones that I can take like year-round, like all the time, like, even when I'm not pregnant? But they said no, of course. So when we got pregnant with our third child, we knew, okay, my vision is going to go down after this birth. We're going to be prepared. We're going to start learning some blind skills and how do I do things if I can't see? How do I take care of my baby if I can't see them? How do I know that they're smiling? How do I know that they're okay, content, or not turning blue? And all these fears that mom has, but mine are hiding because I can't see my child. And so we got a lot of help from individuals in my community. Now I'm going to shout their names out because I love them. Ms. Shelby, who is my vision rehab therapist. Mr. Brandon, who's my accessibility technology, so I can learn how to work my phone and work the computer. Ms. Janice, who's my blind therapist, I talked to her I don't know how many times after I gave birth saying I'm okay versus I'm not okay. But each time we have a baby, my vision is going to go down at a rapid decrease. And so people ask, why do you have more babies? Why don't you just stop and save your vision? We had an idea of what our family was supposed to look like when we first got together. We wanted 4 kids. We were on baby number 3. I don't know about number 4. I don't know. But we're on baby number 3. We wanted a big family. We wanted that happy family that had really much in a sense. And so I'm not going to let my vision stop what we wanted in our household and we wanted in our family. If I go blind, I will not be the first blind mom. I will not be the last blind mom. There are organizations out there. There are people out there to help me to walk through this journey and understand how to take care of myself so I can take care of my family. There are communities out there, just physically communities, as well as social media communities of who would I talk to and how do I do things? How do I travel, even though I don't drive, with my child and make sure that we all get to our destination safely? And so I'm not going to stop having babies until I'm good and ready, just because of my vision. And so, like I said before, I'm not the first plant mom, I won't be the last, and I think it's a bit of resilience and determination just to keep pushing forward to make sure that my kids are taken care of as well as myself.
So you are the definition of bodily autonomy, choosing how and when to start your family. And I just want to tell you, you are an inspiration in this mothering journey. Yes. So one of the things I've learned along this wonderful path of motherhood and entrepreneurship is how policies actually influence a lot of the stuff that we do. One of my really good sister friends, a great partner of mine, her name is Janae Johns. She runs an organization called Once Upon a Pregnant. She focuses on Black pregnant families, right? One of the things that she taught me a very long time ago is if the policy does not include the language of where our marginalization is, it actually creates exclusion. Right? So when we're talking to moms who are living with HIV, when we're talking to moms who are Lyme, we're talking to moms who are in that space of morbidity, if those pieces of language are not included in legislation, we actually can lose out on the kind of resources that we may be looking for because they literally don't exist, right? So let's talk a little bit more about that. So when it comes to public policy, what kind of things or what kind of language do you think we need to really see when we're trying to address our moms and the margins of where we live?
I think, it definitely varies. Just think of the very different stories that we all have up here. So I can think specifically about moms living with HIV. One of the biggest barriers, like I said, my desire was to breastfeed all of my children. That was my personal desire. And, when you go give birth, that's what you see in labor rooms is breast is best. And, all of these different signs, and that's one of the things they ask is, will you be breastfeeding? And come on, let me help you latch. And all of these things that are so exciting for someone who does desire to breastfeed. However, as a woman living with HIV, that at the time was not an option. So the option was taken from me. On the bottle, on my medication bottle, it used to say, if you are taking this medication, do not breastfeed. If you go into the doctor, and still, even though a lot of policies have changed since, if you go into the doctor while you're pregnant and you tell them that you desire to breastfeed your child, a lot of doctors at the time would tell you that they will call child protective services on you. So now you're criminalizing me for something that is supposed to be good for my child. So I'm now poison to my child, harmful to my child. However, like I mentioned earlier, there's a term called undetectable. Right? So they have something called U equals U. Undetectable equals untransmittable. So a person who is living with HIV cannot transmit HIV to a person sexually. So why does that not translate to breastfeeding? Right? So if I can't transmit it to someone sexually, how can I not, why is that a thing when I'm trying to breastfeed? But what the issue is it's not a priority. The research wasn't being done. So it wasn't that it was impossible, it's just that, we don't have time to research that and create policies around that and stuff, so just don't do it or you're going to get in trouble. Right, so it's very important when it comes to things like that because that, for, like I said, for someone like myself who desires to breastfeed my previous children, that caused some serious depression. Because now I feel like I can't do something that I very strongly thought was best for my child and in my situation. And then knowing that if I do decide to do that, I wouldn't have the support of the doctors. What if I do decide to do it? What is best? Is there a medication that I can give? What are some options? It's just no. Do not do it, or we're calling child protective services on you. So, those are the conversations, within the HIV community that needs to have. What are the policies? What are priorities? What are those conversations that we should be having that we're not having so that we can then begin to create those policies around it?
One word I don't like is the word no. Do not tell me no, I'm gonna find a way. I'm gonna find a way.
And I think it kind of goes back to what you were saying, like Grandma said, you know, I was one who, the doctors, they're the ones with the degree, so they must know best. They told me no, so I believe it. And that, you know, I got stuck in that space and it was just a no, and I never did any pushback or anything. Never thought it was even a possibility to push back.
And I know in our previous conversation, we talked about alternatives, right? So outside of formula, there are milk banks, right? So we have human milk banks, people have access to them. I'm gonna put a little star next to access, but people have access to them. But in my research, there are several people who are ineligible for being able to receive human milk bank donations, and living with HIV is one of one of the ineligible factors.
But you don't get breast milk?
To receive, not to donate. To
No, to receive.
To receive. Like,
Someone else's breast milk.
Do we know why that is?
Yeah, why is that?
Somebody answer.
do you want me to say that?
Yeah.
Because they don't want you to have it. Because they don't want you to have it.
There's no reason other than they
There
just
is
don't
no
want it.
reason. No.
That's not good enough.
I went to the California Breastfeeding Coalition Conference. This is in 2022. This is actually how we ended up getting connected. And I was so upset. I had to like leave the room because they were talking about all of these different ways of how people get access to the human milk bank and what you can do to donate. But they were very clear. If you have a diagnosis of HIV, you are ineligible to donate and to receive. I said, wait a minute. I understand if you're saying they cannot donate, but if they are not able to receive, what does the receiving do? Like, if they get the milk in their hand, is it going to magically have HIV? Like, I'm confused. Like, what does that do? And they're like, well, we just don't have the information. We don't have the resources. There's no evidence base. I said, there's no evidence base they can't donate. So it has nothing to do with the receiving.
How do we make some noise around that? That's crazy.
Yeah.
And this is why policy is very important. And this is also why we have to have these open conversations, right? You don't know what you don't know. You don't know what you have access to or what you don't have access to until you meet these barriers, right?
Yes, I also want to bring light to the fact that some policies are now changing. There has been a lot of work around moms who are living with HIV who want to breastfeed. So they are now supporting women rather than discouraging them. They're now, for women who do want to breastfeed, they're now open to having a conversation. So now it's just more of a provider barrier. Because although policy may be changing, providers may have these preconceived, stigmas, and they're like, no, I know what the policy says, but I'm not dealing with any of that. So before policy did change, there were several providers that you could kind of go to and have the conversation because they were open to it, but now it's switching, so policy is beginning to change for the support of the woman who is living with HIV and has the desire to breastfeed.
I feel like those policies are made from somebody who's never been in your shoes, who doesn't know anything about walking in your footsteps. And I think it's really unfortunate. In the healthcare field, so being a nurse and being as a case manager, I work a lot with the insurance companies, and I am getting a prior authorization, which means the doctor wants to give a certain medication or procedure to somebody, and they have to ask the insurance company, is it okay? Can I do this? You go pay for it? But the person on the insurance company, they're not doctors. They're not in the medical field. So why are you telling the doctor or the medical field what's good for their patient? And I feel like that is so wrong. And I would love to find a way to change the healthcare system, yeah. Because if they are the doctor, and yes, ask questions, right? They are still just a human at the end of the day. Why are they asking someone who does not have a medical degree if it's okay, if the insurance company is going to pay or not pay for someone to do something? And to piggyback off of your story of how they discharge you within 2 days, that is definitely a real thing. In a hospital, the more, and I apologize, healthcare, for saying that. No, I don't apologize. So, the faster they get patients out, the faster they can get patients in, the more money they can keep. And I think that is a horrible way to run our healthcare system, but it is the way it is at the moment. And so the more we make some noise around it, hopefully it will change. Because after birth, I want to go home. If I'm ready to go home, let me go home. But if I need to be there, let me stay in the hospital. Let me stay with more doctors and nurses who have the education to make sure that your experience does not happen. Don't kick me out. so that you can get somebody else in. Yeah.
I know one of the 8,000 hats that I wear, I'm a special state officer for the state of New Jersey for the Maternal Care Quality Collaborative. And yes, and one of the things that we discuss is how do we develop better quality measures. And I talk to them about you can't create a quality measure without the people who are asking for the quality of care. Right. So there's this thing called value-based payment. It kind of went away because of COVID and trying to creep it back, right? But essentially what it means is your medical provider is not going to just be reimbursed for the care that they provide to you because you went to see them, right? That's pay for service. They're actually going to be reimbursed by the quality of your care actually improving, right? So if you've been under the care of this medical provider for 10 years, diabetic, you lost all 10 of your toes, that doctor actually has not been adding to the quality of your care, right? It's actually been declining since you've been under your care. So this is now holding the medical providers more accountable for the decrease in your quality of life. And there are so many things. I'm not saying it's all just on the doctor, right? But there are so many things that can contribute to, the decline in your health care. But I think this is where we have that conversation around integrating each other into our care, right? So from our initial conversation of doctor knows best, whatever doctor says, we have to change our own mindset also of not letting the doctor make all of our decisions and then we just suffer with the consequences, right? Because a death is a death. They'll tell you all the ways of how we could have saved you when you're gone, right? But I'm incredibly tired of us dying in real life and living as statistics. But the way for us to do that is also getting involved, So, next question, because I'm getting a question. So my next question is, how do we put more parents and families and individuals into the advocacy seat? So I know where we all sit. We're doing the work through our organizations, we're doing work with other agencies and things, but how do we talk to other parents who may not even realize that they are advocates? How do we get into that space?
You are an advocate the moment you become a parent. You have to advocate for that baby, right? You have to stand up, you have to say something. The moment you get that test that says positive, you are now an advocate for that child. So, yes, you don't know what you don't know, but figure it out. Ask questions. We have AI, we live in 2025. We have technology everywhere. Ask the questions. If you don't understand, ask some more.
And I think even prior to that, having the conversations around, we spoke about this before too. One of the things that I do, I keep a note in my phone about anything that may be going on with me. And that way, when I go to my doctor, I'm running off this list. And I don't care about your little 15-minute time block. We're going to sit here until I get through this list. And I can tell you all of the things that are going on with me. Because one thing that I realized, actually at my last appointment, I went through this list of different things that were going on with me that in my head weren't related at all. But she said, wait a minute, all of these things are related to this right here. So let's now talk about this one thing so we can start taking care of all these things. So it's about advocating for yourself as well, learning how to do that, being okay with doing that, and being able to speak up for yourself, and then understanding that medical, some of those medical terminologies. Like sometimes, just like we were saying, we just say okay to these doctors because they're the doctors, but wait a minute, why are you switching my medication? Right. I've been doing fine on this. Why are you putting me on this one? Is it because it's going to be better for me, or is it because they're paying you to prescribe this medication? Right? Okay, or if we're going to stay on this medication, okay, these are some of the side effects that are going on with this medication that is listing, but I didn't even realize, okay, you're talking about one of the medications the medication that I take right now, it causes weight gain, it can cause elevated blood sugar, it can cause these different issues, but if I don't know that, and now I'm in here working my butt off in the gym, eating right, can't lose weight, now it's affecting my depression, and that's affecting how I parent. Right, so it's all about being able to be open to have these conversations with your doctor. So if you want to find a doctor that you can fire your doctor. If your doctor is not the right doctor for you, then find someone who is. You know, and keep going until you find that person that is right for you. I had a doctor before that I just was not comfortable with because all she kept prefacing every sentence with, well, I tell all my HIV patients to. And I'm like, damn, I'm here for a general doctor's appointment, right? You know, but I wasn't comfortable with that, and she wasn't ready to change the language because I challenged her several times with it. She was not willing to change the language, so I fired that doctor. I went and I filed a complaint, and then I found a new doctor. You know, and now I'm open. I can have conversations with this doctor. We can send emails back and forth. She sent me a book about being vegan. I'm not ready to give up my pork bacon. So sis, thank you, but you know, I'll read the book, but we're not going there yet. But you know, just being okay with having those conversations with your doctor so that you can, you know, you can live the best life that you should live.
Yeah, I'm just going to piggyback off the both of you, especially go back to Jennifer's comment about you are your child and your unborn child's first line of defense. You are their advocate. And then when they start talking, you start teaching them how to advocate. And so, you know, fortunately for my upbringing, I had a mother who was heavy into activism and advocacy. And 9 years old, Mom, I don't feel good. Here's the doctor's number. Call. I'll be right here with you. Tell them what your symptoms are. We would go to a restaurant. That's what you want to order. Tell the waitress. Like, that's how you begin showing your children how to use your voice. Because mommy's not always going to be, like I almost wasn't here to advocate for my children. And so I taught them what I'm sorry, when I think about not being here with my kids under somebody else's care, it just does something to me. However, I found my strength in my voice in giving back to the community and helping families and couples stay together and come together. And so just teaching your children how to advocate for self with the little things that you can do on a daily basis that you don't even realize you're helping them use their voice to speak up for themselves. Get them young. We have to tap into our youth so that they do become a birthing mom, a wife, a partner. They're ready to speak up. I'm here blinking back tears in my daughter's lashes on me, so I gotta keep it. I just thank you so much for really being here, being brave, showing what courageousness looks like in melanin.
Beautiful melanin.
Yes, beautiful melanin. So I want to take this time to actually open it up to the audience and see if we have any questions. Yes.
I don't have a question, but I just have a comment. A couple comments. One about HIV, because I just did a webinar on this last week, HIV and lactation. I'm an IBCLC, a lactation consultant and a full spectrum doula. The transmission rate for mothers that are undetectable is less than 1% via breastfeeding. So just for y'all to know that the research is changing, but it takes time. And thank you for me to advocate, but also I learned something new. I just did this webinar literally like 3 days ago. And it used to be recommended for mothers who were living with HIV and wanting to breastfeed outside of the United States, mostly in sub-Saharan Africa, that it was recommended. And so the webinar was about why aren't we talking about this in high-income countries and only talking about it in low-income countries as a life-saving measure. We know that it is. Breastfeeding is food, but it's also medicine.
Yeah, thank you.
Any other questions? Yes.
So Jay, when you were talking about policy, and pretty much my question to the panel is, as a community member, like I have my master's in public health. I was fortunate, I was blessed, but not everybody has that. As a community member, how do we bring how do we bring the community to the table? How do we keep them interested and engaged to be a part of the policy making process? And then on the flip side of that, with some of us and the institutions and organizations we're involved in, how are we ensuring that the community is involved from the initial onset all the way out to the outcomes that we see?
So to start with, how do we get them, these policies changed? Vote. Get out there and vote. If you stay home on your couch and you complain about the administration, but you didn't vote, you don't have anything to talk about. Get out there and vote. And it's not just the presidential election, right? There are so many other elections over the course of that 4 years. Find out what's going on in your community, find out who you want to vote for, and get out there and vote. That's the only way we're going to start changing some of these policies, is getting the right people in the right seats to change those policies.
And I also think having regular conversations. Just having candid conversations with people, because sometimes we tend to silo ourselves, right? Feel like we're all alone in the things that we're experiencing. So I'm sure there's been plenty of times that you've had a conversation or you overheard someone else talking, you're like, girl, me too, right? Actually, segue into, so like I mentioned earlier, I have a nonprofit, IMU. One of our programs is called Sis Me Too. Literally just based off of that conversation, storytelling, because when we share stories, we realize that we're not alone in a lot of these situations. So I feel like sometimes when it comes to policy and advocacy, we try to use such big words that aren't always necessary. You know, if we bring it down to a regular conversation, just like we're talking about here, you know, hey, this is what's going on. I wasn't able to breastfeed because such and such. You know, they tried to put me out of the hospital because such and regular conversations, and it brings light to certain situations. And then you can begin to have bigger conversations and bring people into the room, because we're all not meant to do the same work, right? So we have people who know the big words and can get the big words over to the bigger people, but it also needs people that can have regular conversations without the big words too. You know, so we're all necessary in every space. So just being okay with having those regular conversations and being vulnerable and being transparent with your story.
And those conversations in all platforms. So this platform is more of a sophisticated platform, right? But go out there with your t-shirts and your jeans and your fried chicken and talk to them, right? Bring those people in. They will come. If they will come.
They have chicken here too.
Just add, tell a friend to tell a friend. You know, this room has a lot of like-minded people who want to learn. But sometimes we have to force those who don't recognize that they may be experiencing postpartum or experiencing some form of depression or may not know how to get the help. Sometimes you gotta bring them to the help. That's how we reach the community. We reach the community by being in community. Every single one of us in here has the power of advocacy. And public speaking may not be your thing, but maybe talking one-on-one, telling a friend to tell a friend to tell a friend, come to this event with me, it's gonna be some good stuff. And it's gonna start breaking those barriers, it's gonna start eliminating stigma, and it's gonna create our communities to be more united once we're getting all of those educational pieces.
Just to add, can you hear me? Just to add to that, two things that we've been doing is, one, we have a coalition, so it's about connecting our communities for New Jersey, and we advocate for Black and brown families between prenatal to age 3 of the child, and the goal is to understand, again, where these margins are, and what are those issues that are preventing them from getting to the resources that they need, and how do we make sure that those resources are more accessible to them. So, New Jersey's a big little state, and it's nothing for people to just jump counties to get another resource, right? But what that actually does is it creates imbalance. So say I live in Hudson County and I go to Passaic County to get a resource, Passaic is going to get the count. And they'll say, we have a bigger need because this is where we more come, right? And then it takes away from where I actually reside in Hudson County. And it gives the state a different picture, right? This is also why it's important to understand the difference between qualitative data, words, statements, and quantitative, right? So those metrics and those numbers, that gives us the data that we need to make a decision. But if we don't understand the full story, which is why we have this panel, right? We don't know what our next step can be. And then our second way of getting more families involved in that is our advocacy training. So our Fight the War training, we train more than 3,500 people nationally as well as in 2 additional countries. And we've been able to see these moms and these advocates just completely buzz out, and they're going to their state government, and they're even going into local government. Super cool story. The moms we did a training for in the UK with our partner, Global Child and Maternal Health, and those women actually took their training and went to the parliament, and now they're introducing maternal health equity bills to the parliament in the UK. Again, it's really showing us how having these community conversations can help us build our confidence so that we can be those advocates that we need and we want to see. It also gives us the representation so that we know there are people who look like us, who understand where we're going, what we're going through, where we want to go, and what the next step is, right? And like you were saying earlier, advocacy is not just the person that's sitting on stage or sitting on the podium. It's telling your neighbor. It's getting involved in voting. It's understanding your lived experience, and that's a part of what your advocacy journey is. That's how you change the world. That's how you build out what's missing in the policies and procedures so that the resource actually is available and it's accessible and it looks like us. And it doesn't take 10,000 jumps and hoops to jump through fire to get it, right? So we are able to change that. We're able to give more people insight on the barriers that prevent us from thinking that we are a part of it. We just have to live through whatever they tell us. We're the ones that are able to change it. Right?
Then we get to tell your story like you can.
That's it. Yes?
Hi, first of all, thank you beautiful ladies for doing the work that you're doing and also just opening up this space to have this conversation. It's obviously so important, and I've learned so much just from sitting here in the audience and cried, and also just felt like, yeah, this space is so amazing, and I'm just so appreciative for the work that you guys are doing. And with that being said, I myself, I didn't know about the Black maternal health crisis until I was a sophomore in college. Obviously, being a Black woman, I think that is a huge issue. So you guys being in the spaces that you're in, having the conversations that you're having, obviously I would say that like the majority of the age group are adults, but the conversations, or I don't know, I don't want to assume, but what are the conversations that you're having with youth? Like what is the sentiment around that? Like, are you talking with young Black girls that know about the Black maternal health crisis? Are they informed? Like, is this, like me, the first time I'm learning it is researching it, writing a paper in college. Like, what is the their knowledge like in this space with you guys, just being in this advocacy space?
Yeah, that's a really great question. I have an answer. Actually, in about 2.5 weeks, we're going to be a part of the teen conference that's actually hosted in New Jersey from Planned Parenthood, where they actually bring teens from all over the state, and they completely run the conference. And we talk to them about reproductive health, body autonomy, knowing what advocacy looks like from that teen lens. We also have space for teen parents, so that they can also talk about what does that intergenerational space look like, where they're still being parented while being somebody else's parent, right? Like, what does that look like? How do I advocate for myself if I still got to ask permission to go outside, right? But it's very important, like you're saying, like to introduce those kind of conversations early. So, shout out to my kid in the corner. But these are conversations that you do want them to have with the right information, right? So for us, we actually partnered with Planned Parenthood and co-created a curriculum called My Black Health is Beautiful. And that curriculum really centers how you look at your body, how you ask questions about your body, what does holistic health look like, right? So not just, I physically feel well, so I'm well. What are all the other parts of health and wellness that really amplify who you are and how you feel? And also the advocacy piece. How do you speak up? How do you step back? How do you tell them, you know what, you actually aren't the provider for me. This is what I need, and it's geared specifically towards teens and young people. So I think it's like 14 to 26 is the curriculum. And we've been really fortunate for that to not just stay in New Jersey, but actually the National Planned Parenthood Federation picked it up. So now they're teaching it all over the country.
So, kind of a question to piggyback off of that. So, when we're all young teenager girls, we go to the OBGYN for our first appointment, and it is scary because it's our first time and whatnot. I wonder if there's anything at the OBGYN office that starts that conversation of, of course, we're all going to say, abstain from sex, right? And we are in 2025, we are having babies that are older and younger age. Are they starting that conversation at your first appointment at the OBGYN?
So actually, probably not. But those conversations, I already said I'm a nurse. One of my first jobs was actually in pediatrics. And the pediatrician is actually the one that's supposed to start that conversation. So once your kid starts to become prepubescent, they should start having the uncomfortable, hey mom, can you step out for a moment so I can talk to your kid? And it's not just for girls, right? So these conversations also should be happening with your sons, where they're understanding how do you use your body? Are you experiencing any of these feelings? Have you had an erection? Have you, all of the other things? I remember, quick short story. The first clinic I worked in, we had a teen night where we had kids 11 to 19 that were coming in. They were coming for STI testing, they were coming for pregnancy testing, treatment, all of the things. And we maintained their privacy because, of course, we don't want them to feel like this is not their safe space. But it really showed me, why are we opening this up to 11-year-olds? Like, well, apparently, if we're opening up to 11-year-olds, they're being active. Yeah. So it taught me not to lead with a judgmental lens, but a more compassionate. So I'm like, all right, if there's an 11-year-old that's coming in here, I'm sorry, that's a little shocking. 11-year-old's coming in here talking about anal sex. Yeah. I have to know how to put on my brown face and then also be compassionate and educate that person so that they understand the gravity of having anal sex at 11 years old, right? And then I have to have a conversation with my colleagues of, we're seeing a trend of 11, 12, 13-year-olds who are coming in here talking about having sex in different orifices. How do we actually create more resources? Because we're seeing it in our data, right? How do we have it? How do we put the story out here so that they feel comfortable talking about it, And then on the opposite side, how do we have these conversations with parents, not outing the children, but to make them more aware of what's happening and what's happening in their own neighborhoods, Because these kids having sex with somebody. So parents also need to be able to.
And I also, to go right along with that, for us as parents to have the age-appropriate conversations with our children too, and not have that when it's that weird age, like, hey, you're now 14, come let me talk to you about body parts, because then it's like, mom. First of all, I already saw everything on Instagram, so TikTok showed me everything I needed to know. But starting it young, naming those body parts, what those body parts are actually named, they're not going to call them boo-boos and cookies and hot dogs and all of that kind of stuff, right? Yeah, right. It's a penis, it's a vagina. Because if somebody comes home and says, hey, they grabbed my cookie, are we really talking about cookies? Or, like, what are we really talking about? They go to, someone who they trust, and once they actually say something happened, we want them to be able to articulate that with the real words, right? And then, with the little ones, talking about good touch, bad touch. The doctors may look at this or touch that, but only when I'm in the room, or, and then not being that parent. You said they get to the age where the doctor is going to say, okay, you're going to have to step out. Don't be that parent. It's like, I'm not going nowhere. I'm going to stay right here. If you trust your child's provider, hopefully that's something that you do, you do trust your child's provider enough to be able to go ahead and step out of that room to give your child that safe space. I'm very happy that my children have people that they can go and talk to when they're not quite comfortable talking with me. I try my best to create that space where they are comfortable enough to come to me with things But I also made sure I created a village around them so they can go to someone else in the cases where they're like, I'm not really ready to talk to mom, and I trust these people's advice to my children.
One thing I saw on social media, so social media can be bad, but it can also be good. And so this is not my idea, it's not my thought, I'm just gonna steal it from somebody else. One way to talk to your children or any children about those uncomfortable conversations is in the car. So you are in the car, your hands are on the wheel, you're looking forward at the road. They are in the back seat, so there's no eye contact. You don't have to have weird eye contact with them. When you start the conversation, they can be looking out the window, talking about their vagina or their penises or whatnot, but you're having that conversation, and it's not awkward because you're focused on the road straight ahead. You don't have to have weird eye contact. And then later when you get home, you can start having those eye contact moments and say, okay, let's really dive in. But at least start the conversation, and one way to do it is in the car. So it's kind of like, we're on a road trip, we're going to be here for an hour anyway. Let's turn the music down, let's talk about it.
Right. Yes.
From what I've observed from this conference and also from past experiences, or at least understanding them, what I know of, a lot of hospitals, or like large known hospitals, at least don't emphasize the fact of trying to help their patients, either with treatment or actually trying to listen to them. But what about smaller hospitals, especially those that do not have enough like beds, treatment, or anything that will help their patients? Is there any like way we can help them, or anything that would be like helping their situation more specifically?
So those smaller hospitals, if they don't have the resources to take care of that patient, they ship them out to a bigger hospital. They make sure that they're stable and that they're okay, and then they either get an ambulance, a helicopter, however, and they get them to the closest bigger hospital that has the resources to do so. And so that's kind of how they bridge that gap. But first, they got to make sure you're stable before they can have you walk out the door.
I think also you're also addressing maternal care deserts, right? So we know that there are hospitals, certain hospitals that will give them, that have a labor and delivery board that will assist in the birthing process, and some hospitals that don't, right? But then there's also spaces that are in between, where there's not an OB, there's not a birthing center, there's not a person that can actually facilitate birth. And when that happens, that actually increases the chance of morbidity or mortality for that pregnant person. So, one, what we can do is create more awareness of that, right? So if we go to the March and Arms website, they actually have maternal mortality and maternal care desert map of the United States. So it actually shows you how big this problem actually is. And what we can do is actually start addressing our legislators and pointing out, I live in your state. I live in this bright red spot where there's no place for my moms to give birth. How are you actually going to represent me and say that you're here for my best interest if you're allowing this to continue to be a desert, right? And then we can also, really going out the rabbit hole, continue to overlap the other deserts that also impact what that mortality and morbidity rate looks like, right? So we can look at food, we can look at other resources, we can look at jobs. Like all of these things continue to overlap. My colleague in the UK, she has a report called Black Child Clean Air that associates what we call here in the US redlining to the air quality and how that actually contributes to preterm labor and mortality and morbidity rates. So there in the UK, they don't call it redlining. It's just like, that's just where the black people live. Okay, great. We know what it's called here, right? But same map, different place. So that's why I want us to understand this issue is not just a US issue. This actually is a very, very prevalent global problem. And we have to be aware and remove those silos of thinking, well, it's just here or it's just over there. It's not. It's everywhere. It's everywhere that a person who has a uterus is. So we are everywhere, right? So we need to understand what we have access to, what we don't have access to, what resources actually exist. So, talking about that map, these things exist. They're accessible. This is public knowledge. But if we are not having these conversations, we are only going to continue to fall victim to them. I don't believe in being a victim. I'm going to survive every day.
Absolutely.
And I want us to be able to survive with the right information. Not just how I feel, not just from my lived experience, that is valid, but I also want to use the information that we do have access to as a lever for us to get through that, and know that we have a way of not continuing to see these disproportionate rates of us dying or having morbid consequences. Right? I know the most recent report, I think it was 2023, that went through each state, the mortality and morbidity rates. The only race and ethnicity that continues to be disproportionately impacted by this mortality and morbidity is Black, non-Hispanic women.
Yeah.
The only one. So we cannot continue to watch ourselves die and become extinct and watch them documented. We have our own civic duty to each other and to ourselves to change those narratives and to be equipped and well informed with the information. And we also have the great ability of looking at each other here, regardless if this is your job, if this is your lived experience, if this is the first time you heard this information. We all have the opportunity to create partnerships here, so we can carry this message outside of this room, because it doesn't start and stop here, right? So if we understand the power of partnership, this is how we also see those policies change, the resources we acquire become more available, and activate more activists.
So we're making noise around it, right? This has been a long conversation for I don't know how many years of Black mortality. And I don't know if any of us can answer this question, or anybody in the audience or in the series, somebody answer the question. Is it getting better?
No.
No, it's not. Is it leveling it out?
No.
Is it declining?
So it works.
It's getting worse.
2020, the morbidity and mortality rate with birthing Black moms was around about a 3% higher rate of morbidity and mortality.
What year was this?
2020,
2020, okay.
2025, 2024. I don't know 2025 statistics. We're only 5 months in. 2024, we're over the 7.6%.
Really? Yeah.
We're closer to the 8% than we are at the lower 7%. It's getting worse. It's literally a crisis. And I just wanted to add to Jay, what Jay was saying, this is a problem wherever a uterus is in any country. And just one thing that plays in my mind, if we're all here familiar with Emmett Till, and his mother, Mammy Till, made the statement that she stayed out of what happened in the South. That don't affect me. That's not my problem. That's a y'all problem. Until it affected her. And this is a very similar and very relevant crisis and issue that as a Black woman, whether you choose to have a family, whether you choose to have children, whether you choose not to, as a Black woman in community with other Black women, it is our due diligence to make it our problem, whether you choose to have a baby or not.
I want to ask, something you said earlier, actually also just, I think you got what you were saying, sorry. Earlier you said, Jay, when you were pregnant the first time you went to your family. So what do we do? How do we get to the nannies, the big mamas, the aunties, the TTs? How do we get to all of them to change that message that, do whatever the doctor says. It's God's will. It'll be fine. You'll be fine. You're strong. You're a strong Black woman, been through worse. How do we get to dismantling that narrative and to get them to change or to think about things different, to say, you know what, this is not okay, and this is something else we need to fight for like Annie did. There's something else that we need to do. Thank you.
That's a great question. Two things. Shameless plug, call Melinated Moms. Yes. But there is actually an organization called Dr. Shalon's MAP. They are based in Atlanta, Georgia. They are led by Wanda Irving. Wanda Irving is the mother of Dr. Shalon Irving. Dr. Shalon was a double PhD. She was a military vet. She literally wrote the book on, like an actual textbook, on Black maternal mortality, and actually died of the same things that she wrote. This is the spoken word, right? Her mother decided to not just sit in her grief of losing her daughter and now raising her granddaughter, but to start her foundation in honor of her daughter. And she's been actually going across the country, meeting other grandmothers who are in that space of mortality, where they're raising their grandkids, but they have those same mentalities, right? They're like, well, when I was a mom, I didn't have all these things. I didn't have all this access. So she's speaking to them from her lived experience as a mother who lost her daughter, but as now a grandmother raising this next generation. So she's learning new things of how do I parent a child in this generation. Some of the things that I learned before are outdated and antiquated, right? So she's learning new ways of having those kind of conversations, but then she's also bringing it to that other generation to say, yes, I'm not saying that what we did was bad or good, that we did the best that we could with the information that we had, right? But here's how we expand our knowledge. Here's the way that we also can learn new things through the access and technology that does exist, you know, and she's bringing women in. She has an amazing retreat for them, but she's continuing to have more advocacy conversations with them at the table so that they also, again, don't feel alone, but they also know what the next steps look like. You know, how do I unlearn things that I thought were good? How do I learn new things so that I can parent this grandchild to be the best next generation? So that's my solution. Yes.
Thank you. He's an advocate for me because I'm in the corner. I just wanted to say first, like, there are not enough words to talk about the gratitude of the space that you guys created tonight. I've been doing this work for almost 10 years, and this is the first time that I've seen a panel that has such diversity and stories, as well as just a space for a mother with a disability to share her story and be advocated for, and also the invisible disabilities that you spoke about. So I just really want to give y'all so many kudos for that, because this is so unique. Just to share a little bit about my background, so I'm a maternal child health advocate. I've been doing this for almost 10 years. I'm also a doula, and I'm a public health analyst as well as consultant, and everything that I do is like maternal child health. So I'm really good about advocating for my clients. I'm really good at talking to my community about this stuff. One of you mentioned how, like, we got doctors and PhDs and all these people who know all the big words but don't know how to speak to community, so I'm really good at that as well. But I think my struggle is that I'm going through my own personal health issues now when I'm thinking about having children, and also recognizing that not only is Black maternal health an issue for Black women, but just health in general, and the fact that we are more likely to be diagnosed with autoimmune disorders, we're more likely to be diagnosed with chronic conditions, especially at younger ages. And so I'm going through that now. I'm having a hard time advocating because I'm tired of having to advocate. The amount of doctors that I've had to see just to get to the point where I'm at, which is still no answers, has been very exhausting. And so I just wanted to know if you guys have any words of encouragement or any advice, or if you guys have any personal experiences where you were in that space where you had to advocate for yourself outside of, like, birthing and outside of, like, the reproductive health space, but just in general about our health. Thank you.
I think you're doing a good job advocating for yourself and asking the questions and going to different providers and such. And then to kind of figure out what the next said, making a list of your different symptoms when you go to the doctor. It only gives you 5 minutes in the doctor, as you probably already know. But if you can make that list and they start to pinpoint all the different things, and then it leads that one diagnosis and says, okay, now we kind of pinpointed it down or narrowed it down, we can treat this one thing is really good. But I think you're doing an amazing job of just speaking up about it. In 10 years, girl, kudos to you, because you're doing it. So that is amazing.
Yeah, and also, just continue doing what you're doing, and I know it's going to get tiring. Because one thing that I've shared recently was I just want to go to the doctor and be a patient.
Right.
Yes.
I don't want to go to the doctor and be an advocate. You know, I don't want to have to go in and be listening for things that need to change and things that need to be fixed and a system that needs to be corrected. I don't feel like that. I want to go into the doctor and just literally be a patient. I've had to fire therapists too in the past because I go into and speak with my therapist, and they're like, you know, in the very beginning, you're building your rapport, and I'm like, so what do you do? And I start sharing, and they're like, oh, wow. So tell me a little bit about the time when you, well, what did you say when, you know, but now they're leaning in and they want to know more about, like, this is now not a therapeutic environment, now it's a whole business exchange. And I'm like, this is not what I came in here for. I did not come in here for advocacy. So I say that to say, there are going to be times where you're going to get tired of advocating for yourself. And that's okay. Take a step back, breathe a little bit, do something a little different, and then, you know, get back to it. But also find your community. You know, find the people that you can talk to, and find those people that you can, you know, share some commonalities with. Because they are out there. You may feel like you're dealing with all of this stuff by yourself, but there's going to be somebody else that's dealing with all of the same stuff that thinks that she's by herself too. You know, so be okay with being transparent and being vulnerable, like I mentioned earlier, to be able to start to create that community around yourself. So it's now not only you advocating, you have a whole bunch of people advocating right along with you.
To kind of connect those dots, so you are you're a teacher, right? So you are creating these other fishermen. So you're not just giving people fish and they're eating. You're creating other fishermen to spread that word. So you've been doing it for 10 years. That's 10 years of other fishermen now coming in. Grab one of those people that you've taught, right? Grab one of those mentees that now can become a mentor. Say, hey, listen, I'm tired. Can you come to this appointment with me and just be my advocate and talk to this doctor because I'm tired. You're doing it.
And that's exactly the encouragement or advice I was going to give. So to piggyback, find your tribe. And if you don't have a tribe, tap into Melinated Moms. Tap into the tap into Peaceful Minds Haven. There's so many resources out here of advocates that are ready to advocate on behalf of you. So tap into those resources, and that's what we're here for. It's going to be tiring, and I can tell you, I had to tap in. I called Jay, and I had Jay crying. I'm silenced. I don't know why. This is what I do for a living. Why can't I tell these doctors, you hurt me? My spirit is broken. I almost died. I couldn't get it out for like a year, you know? Not knowing I was experiencing postpartum depression, but still getting up every day going to work. Like you said earlier, we put on this facade like everything's okay because the Black woman is supposed to be strong, and really I would go at the end of my shift, I'm rocking in the bathroom, literally. I'm not saying that just to be saying that. I'm sitting on the bathroom floor trying to figure out how am I showing up for myself in this baby. So it's okay to not be okay. It's okay to not be able to show up for you vocally. Tap in.
Okay, and being able to recognize those signs, right? Like recognize that, like you said, you're pushing through the day. You're like, yeah, I'm great, I'm good. You know?
Have that moment. When that dish is sitting on the sink, it's like,
exactly. That's when it's that's my thing. I come home and you just unleash everything on your safe people. You know, I call them my safe people because I know my husband isn't going to leave me if I stab on him this one time. I know my kids aren't going to walk out the door, but it's still not 50. My husband's in the back now, so I heard of this family, I don't know. But, you know, those are the safe spaces that we tend to explode on, you know, and it's not theirs. But just also recognizing that and also inviting them into these spaces to say, hey babe, hey kids, when I do this, that probably means this. You know, I asked a question on social media probably last year sometime, and I said, what does your depression look like? Right. And how can someone show up for you in that space? Because it looks different for everyone. Some people may seclude themselves and not want to come out of their rooms or, you know, not shower. Some people may go into overdrive and I'm overworking. Some may have, like myself, I have a combination of both. You know, so I'm showing up and I'm doing all the things and I'm speaking and I'm smiling and all this, but it's all because that's what's kind of filling me up in that space. But when I go home, I'm under the covers. You know, So recognizing what your depression or what your anxiety or what your PTSD or whatever it is that you may be dealing with, what that looks like for you, and being able to articulate that with people that are around you.
So first of all, I think we can't thank y'all enough, so thank y'all for being here. A lot of spaces that I'm in, I rarely walk in and like see myself, and that's not just from like being a Black woman perspective. Like, I almost died in childbirth as well. My second child, being forced to do a C-section because my hips are too small. Like, things like that they tell you. And I also went blind for a little while too, to her point of like just having these regular, like random health crises. You know, luckily I got my sight back. It was very temporary, but it's scary, you know? And I was a stay-at-home mom, and my ex-husband was military, so I'm like alone a lot. So like, thank you guys for showing up and being the representation that we need. And forgive me if this is not the proper time and place, but I run an organization called Black Blossom Society, to the young lady's point, where I go around to different schools and advocate for the teen moms in my communities as well, because I was a teen mother. I had my first daughter at 14, and I had my second daughter at 19. So how can a smaller business like me be able to reach, you know, other communities and do partnership with other people so that I could reach, you know, more people, so that we don't run into these things where, you know, children don't know about Black maternal health, or, you know, we're not just saying, well, you know, don't get pregnant because right? Like, but somebody has to be there to catch them when they fall, and so that's kind of like, you know, how I show up in these spaces. But it's still very much like DMV based, and I would love to kind of do more like policy change. And it's funny because I just had a conversation with somebody in New Jersey who is actually going to like a conference where there's going to be like policy changes and stuff like that, and I was able to kind of like bounce ideas off of her, like, you know, these are some things that, you know, that I'm looking forward to do in my community. So, you know, is it something that you could speak on for that as well?
So I think these ladies have probably much better answers than I do, right? But the answer that I can give you is that you're doing it. You just keep doing it. And the more you do it, you get bigger, and you reach more people, and you get bigger, you reach more people. Keep doing it. And I know to the other lady's point, you're gonna get tired, but you keep doing it. You're already doing it.
Yeah, I was going to say, to answer your how question, you just do it. You just, and this is absolutely the right space and the right time. And you tapped in, and you've got 4 organizations sitting on this stage, and probably so many more sitting in the audience, and even in the people, I really can't see y'all. Right? It's black out there. I train anxiety too. I've never been this calm on a stage. It's the life they know. However, there's so many people sitting in the audience with you that could use your resource. So that alone, you've tapped into connections, and you've tapped into people that you can help support, who will help spread the word. So,
Before you leave, spread your network around. Talk to more people, network.
And I'll just add to that, we'll take Camille as our last question. So, if you know me, well, you get to know me. I'm a professional conference goer. I'm going to put it on a t-shirt. I average about 22 conferences a year. Wow. This is the first year I haven't gone to at least 10 conferences by now. So that's just what it is. But I would 100%, 1,000% encourage you to actually tap into some conferences. Honestly, go on Google and type in teen conferences and watch what shows up. I was telling you about this coming up in New Jersey. Totally come to that. There are so many places where maybe teens aren't, but they need to be, right? So you might be that catalyst of talking to a clinical provider, or talking about like what those needs are, where those intersections lie, and they'll pull you in and say, oh my God, I never thought about that. Would you actually be the person that can talk about that stuff, and that can generate a check, girl?
Yeah, and to go along with that too, don't just Google the conferences to go to, but don't be afraid to submit abstracts, right? Or look at the list of people, presenters or presenting organizations. Reach out to those organizations and say, hey, this is my experience. You need somebody to speak on your panel, you know? So don't be afraid to do things like that as well. So yes, attend and share your information, but go ahead and do your professional thing too.
Right.
You know, because like I said, we don't need all of those huge words that some people use, and that's something that I've learned to embrace. They used to intimidate me, you know, but now I'm like, no, that's not my space. That's not where I'm supposed to be. I'm supposed to be with community. You know, having conversations with community on the level that God called me to be on.
I'm sorry. First, massive gratitude. This is a very different kind of conversation, especially during Black Maternal Health Week, where you began with addressing systemic harms, and even as speakers, it's just very different. Instead of drawing on how we are strong women and how we went through trauma and we suffered and you overcame it, and then because of that, you are able to support others. It's very grounding to witness you all nourishing yourselves and acknowledging that the greater good is you. So thank you for that. And I wanted to ask you all to speak to thoughts on pathologizing the postpartum experience and what you feel can be done around countering that. And then also where around Black maternal health is often attached to substance abuse, and it's attached to perinatal mental health challenges and disorders versus addressing the root causes from the systems that I guess addressing the symptoms rather than the source. Would you please speak to that more articulately than I just?
Want me to take that?
Yeah, take it away.
Addressing postpartum. You know, I am still healing, and I always take it back to your tribe. It is so important to have people around you during that healing process that can speak up for you. Now, what about the people who might not have a tribe, people around them? There was a young lady in the front, again, I can barely see you, that said you were military, you really were alone a lot. Recognizing those postpartum signs, I really feel that if we could begin educating ourselves of all 4 stages of pregnancy, because it's not just 3 trimesters, there are 4 trimesters, and you get these baby books that you find in the bookstore that tell you, oh, week 13, week 12, what happens in week 45, what happens in week 52, and we need to begin advocating and pushing for more education and more information, more resources, and more preparation around that 4th trimester. And also start tapping into our legislators and our medical professionals to change what a postpartum checkup looks like, because 6 to 8 weeks ain't it. That is the most detrimental part of the 4th trimester, and anything could happen. Advocating for it being a 1-week checkup. Why is my baby mandatory to be checked up on 1 week after the baby is born? But not a mom. That's a problem.
Yeah.
It's really a problem, and so I'm gonna stay there.
One thing I would love to see kind of piggyback off of that is more appointments for the mom postpartum. During your prenatal, you are going to the doctor so many times, you peek in that cup so many times. When you are done to have the baby, that's that 1 appointment, and that's it. That's all you get. There's no therapy. There's nothing. Shame on me. I actually forgot my 6-week appointment about 3 weeks because I'm taking care of the baby. I don't remember about myself. I forget my appointments often. I would love for someone to say, hey, Jennifer, I have an appointment to come to you at this day, at this time. I want to come check on you. and I have about 3 appointments, I'm coming to you to see how you are. Because you're not going to cancel that appointment on get me again. I'm coming to you. I would love someone to knock on my door and say, hey, I'm here. You okay? I'm probably going to broke down. I'm probably going to cry and say, no, I'm not okay. This is a lot. But at least they're there to say, okay, I gotta find a babysitter or take the baby, or I just gave birth. How can I lift this baby in this car seat and drive this car? It's a lot. And so I would have loved, and I wish we can maybe somehow make some noise about that, saying we need more care after we give birth.
And I think even going back to what you were saying with, looking at some of the root things, having conversations prior to conceiving. Right, so how are we making sure that we're taking care of our bodies and we're in the best health, and I know in some instances it may not be practical because, we don't all just plan, in a 100% happy world we would plan it and say, this month I would want to have a baby, but that's not always the case. But in the meantime, let's start talking about, okay, I want to be in the best health possible, so just in case I do decide to, I'll be healthy. So, it's very, very, so an example for myself, one of the medications that I was taking at one point was not safe for pregnancy. But I was in my childbearing years. So why am I taking this? I'm married, I'm in my childbearing years, I'm not on birth control because we had these conversations too. So why is this even an option for me to take this medication? So then it became, okay, so now you're pregnant, okay, we gotta switch your medicine. So, but what if I now have complications because now in the middle of pregnancy I'm switching medications and that's a shock to my body. So it's things like that to have conversations about as well. Making sure that we're going to our regular doctor's appointments and checking different things like your blood pressure, your cholesterol, finding whatever your normal is, because that's another thing too. We doctors tend to look at these charts and put us in these charts, like especially with that BMI that tells me that I'm super obese. I'm looking at you like, whatever, I'm not super obese, I just need to tighten up a little bit. You gotta talk to me like that. A little bit of stuff, I can treat me that way. But, with these charts that are always telling us different things, and, like my blood pressure, and so knowing what your normal is, my blood pressure and my blood sugar runs low. However, if I have a brand new doctor, they're like, oh my goodness, you may need medication for this. No, this has been this way all my life. And my mom was like this, my grandma was like this, so this is okay for me. So know what your normal is and making sure, doing your best to make sure you're as healthy as possible prior to even conceiving a child.
Yeah, so I'm going to ask a question to everybody. Please don't answer, because we do not have time for everyone to answer, right? But think about this on your drive home tonight. What is your one non-negotiable, right? So we talk about a lot of our physical health, but mentally, there has to be something that, listen, I'm going to stick to this because this makes me happy. And for me, to get my hair done. Everything else can go disarray, everything else can, however, but if I can get my hair done once a month, get my locks retwisted, that is my me time. That is my non-negotiable. That is, I have to have that to say, I am okay right now. This is me. So when you guys are on your way home, what is your one non-negotiable? Whether it's you just had a baby and you don't have time for nothing else but getting your hair done once a month. Or you are tired because you are advocating for everybody else, but you just need that one non-negotiable saying, I'm not going to let this go. This is for me. So think about that on your way home, because everybody needs that.
I don't know how to get it. Go get my husband. Hey, husband.
So I'll wrap everything up. Two things. To answer your question, I think just combination of whatever was saying, right? So know how to prepare. What does it look like to prepare your body even before you're thinking about having a baby? How do you live in your best self, right? How do you give your body the best things that it needs in order to thrive and feel good? What does feeling good look like, right? We are often in that space of constantly going, and we're thinking that we're productive, that means we're doing good, right? But are we actually checking in? Are we checking in with, where is this pain coming from? I've had this headache for a while. My stomach hurts. Am I using the bathroom enough, right? Pay attention to your body so that you do know how to talk to your provider so you can be engaged in the kind of care that you need to address those issues. So once you're ready to make the decision to go into parenthood and however that looks, your body is ready for it, and you are mentally and physically and emotionally and socially supported and prepared, right? And then that interconception phase, right? So after the baby, I'm 156 months postpartum, and I keep saying that because I have to remind myself there are still things that I am still dealing with at 40 years old with a 13-year-old, 156 months postpartum that is still related to my youngest daughter's pregnancy, and I have to pay attention to that. I have to know that that impacts the way that I take care of myself and also how I take care of my kids, right? I want them to know what I'm going through, because if they experience these things, I want you to know this might be genetic. I want you to know these are things that you need to ask that I didn't get a chance to ask, right? So they're prepared for that type of knowledge. And last but definitely not least is keeping community spaces like this, right? So, you know I love you. So having that space that you have where moms feel comfortable and safe and secure and seen, it is so necessary. And when we know that we have a place that's in our own communities that look like us, that embrace us instead of pushing us away, that doesn't look at us as just a number or a statistic, that helps us know that we have something else to look forward to. And it helps you look at your baby, even when they get on your nerves, as a blessing and not just a burden, right? So once we're able to really see what community looks like, and it looks different, right? So thank you, shout out for you saying like, this is a diverse panel. It was intentional, right? Like, we're Black women, but we're here in so many different facets, and our intersectionality is not just, it doesn't just start and stop with our race or ethnicity, right? So we have to remember that too. There's so many people in this room, every single one of you need to look at each other and say, I see you, and I see parts of you and me, and vice versa, right? That helps us to know that we are not alone. That takes away what isolation does to us. It helps our mental health. It increases our ability of knowing that our vulnerabilities of asking for help is a strength and not a weakness, right? So, last thing I promise, because we are over time, they give me the Apollo look. So as we close out this program, I want to ask our panelists, if we could build a bridge, not a wall, to close the gap and absorb the aftershock of morbidity and mortality in the United States, what advice would you give our audience as a call to action?
Think a little bit.
Speak up. Don't be silent about it. Share your experiences like we're doing here today. Continue. Don't just let this be the last one. Continue to share your experience. Continue to reach out and whatnot. If you don't want the public speaking, like you said, do the one-to-one. Just tell a friend to tell a friend to talk to a friend to ask a friend. Keep talking about it. And that will help to bridge that gap. I'm hoping it'll help you bridge that gap. So when we do this again next year, that 7% can go down to 6 and 5, and then eventually 0.
Right.
You know, we have that cliche saying of what happens in this room stays in this room, and yes, this is a safe space. But on the other hand, you know, yes, what happens in this room stays in this room as far as confidentiality, but it's always okay to share stories and share experiences. Right, so it's always a time where you can say, hey, well, I heard of a person that such and such, so you can help somebody see that they're not alone. You can share organizations, you know, we've been talking about different organizations here, you know, that appear as well as out in the audience, share things like that. So just sharing, you know, just like you said, Jennifer, just being able to go out and share those things with people and being okay with sharing pieces of yourself as well to make people, help people see that they're not alone.
Yeah, I'm going to speak to the policy part of things. It's so important to vote. Your local, your vocal, be vocal, yes. However, your local and elections within your state, even within your county, your town you live in, your Board of Education, us putting the right people in position to advocate for us on a higher level, you'd be surprised how many assembly and governors and people in legislative roles are advocating for us against this current administration, and they're saying we are not standing for that. You're not going to come to my state, hold any funding you want, but we're not doing that. And so I go back to the policy part of things. It's so important to put the right people in place in those higher positions to continue to advocate for us on those levels. And then we continue to do the community work.
And then I'm going to take that a step further as well. With the policies and everything, make sure you understand what that all looks like. Right? Because we tend to hear vote, 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 go vote, go vote, but we don't even really understand what that means, what we're voting for, who this person is, what does the mayor do, what does the state rep do, who are all of these people?
Senate.
Right, like who are all of these people, what do they do, what is a bill, what is a law, how do I make those changes? Like Jennifer said earlier, we live in a world of AI. I call one of my best friends' name is Tisha, is Chat GPT Tisha. I call her Tisha for short. And I ask her everything. That's my good girlfriend. And that's my good girlfriend. I'll go in there and say things like, please explain policy to me as if I was a fifth grader. Please give me a breakdown of how a law goes into place as if I was a fifth grader. Right? And it'll break these things down. I'm going to tell you, I didn't understand when the whole talk about DEI started happening in the very beginning. I was like, what are we talking about? Why can't I shop at Target? What are you talking about? I love Target. What do you mean? So I put it in there. Explain to me what DEI is as if I was a fifth grader. And it gave me a breakdown of what it was they were talking about. So, that's some advice, that I would have. I'm sure, a lot of us have access to technology. Google, Google has an AI thing as well, so you can use that if you're not good with, the other apps and things like that. So, be okay with finding out that information, and we have that part of us that we know we don't know stuff, but then to think that you don't know that you don't know. And that's where having those conversations come in and things open up. She just mentioned this word. Let me go look that up.
Well, thank you all so much for being here, sharing your stories, coming from all parts of the United States to be here on the stage and share with us. I'm so grateful that you all are part of our community. This is not our last conversation. This is not the last thing that you're going to do. Everyone here, your call to action is to take these stories and amplify it. So take it to your friends, your family, your neighbors, your partners, and talk to them about how do we continue to have these conversations outside of these rooms? How do we do this from each aspect of who we are as a parent? This is not just for women. We want our fathers, we want our uncles. I was raised by my grandmother and my two uncles, and I love them people. And I'm so grateful that I was able to see so many different perspectives of what parenting looks like through those different dynamics. So thank you all for being here and really seeing the value in this conversation. If you have any other questions about Melinated Moms or anything else that we're doing, again, make sure y'all take y'all resource with you, but totally tap into us. But thank you so much. And last thing I want to do, sorry, because they paid us. Thank you to our sponsors. Like I said, thank you to our sponsors for also seeing the value in putting something like this together. So Black Ladies in Public Health Foundation, they have been a fiscal sponsor for Melinated Moms since our inception. They believed in my idea and they understood. They understood that having an idea is not enough. So they gave me the skills that I needed to create strategic planning and really build out this into a movement. So I 100,000% want you all to tap into Black Ladies in Public Health Foundation, BLIPH.org. The Gathering Spot, thank you so much for giving us this space. Really. For standing in this conversation and really giving us the space to talk this out. Also, thank you to Moms Rising. They sponsored our magazine. They were so pivotal in making sure that we have the information available to everyone and everyone has access to it. And last but absolutely not least, Push for Empowered Pregnancy. Thank you so much for showing up and being in the room with us and helping us have those stories of our moms and our babies who didn't even get to take their first breath in this room. Thank you.